Delighted to see such a packed house today.
You do belong and you do matter. And here is very much a safe space today.
Look, we're really excited and proud and thankful to be included in this conference. It really does kind of make a difference.
We're here to launch our guidance for staff working in mental health services throughout Ireland on how they can care better for LGBTQIA plus people. And we really hope that this guidance will help staff to really make a more inclusive, respectful and equitable service for people when they come seeking help.
This year, within this conference, we're able to start having that conversation about making sure that our mental health professionals are more and more ready to meet the needs of members of our community.
It's important for us to support the launch of this very important guidance because we've seen repeatedly through research that members of our community are suffering to a greater extent from poor mental health outcomes, and that oftentimes can be attributed to practitioners not having the knowledge available to them to be able to meet the needs of our community. So this guidance goes a long way to address that.
So, 10 years on, this is a landmark moment for the Commission, not just in the realm of policy and professional standards, but in our collective journey really towards equity, dignity and truly inclusive care in Ireland's mental health services.
So the MHC has a role to promote high standards and good practices in mental health care, and LGBTI service users told us about their experiences in mental health services. And while some of those people had good experiences and positive experiences, so arising from this document, we hope that people who work in mental health services, people who lead mental health services and commission mental health services will use this guidance to implement some of the practical tools and implementation tools that are there to improve the experience of LGBT service users when they come to use their service.
I'm here today at the launch of the guidance, I suppose because I'm trans and I came out. My transition was while I worked for the Mental Health Commission, so I have a particular interest in seeing that my community is better understood by mental health care professionals and that people's identity is understood and affirmed right from their very first contact with the service. I hope that the guidelines will do that. I think they provide a great starting point for a conversation, and I think whether a clinician is new to the concept themselves or has better experience, that they can get something from the guidelines. And I think whether you're dealing with a patient that you know for a long time or someone who's new, they provide a way that has been developed with the community to start that important conversation and recognise the relationship between people's mental health, their sexuality and gender identity, and then the other intersectional elements of their life as well.